Hey everyone, how you all doing? Hope you're all having a nice day. OTDUDE here. Today I want to talk about top 5 must-haves for when you're an occupational therapist and helping a patient with a shower. The top 3 places where you may provide a shower are acute rehab or ARU, skilled nursing or SNF, and acute care. I don't have any experience with home health, so if you guys know in the comments, let me know. But when you get down to participating and assisting patients with showers, the top 3 I think are the ARU, skilled nursing, and acute care. So before we get into actual top 5, this is not an all-inclusive list of the things that I bring with me to a shower. The list is actually much longer, but these are the top 5 things that I most often find myself either needing, using most often, or that I forget and I find myself going back to the supply room to retrieve. But it's a pretty high likely chance that I use it almost every single time when I give a shower. Number 5 is occlusive dressing. So you'll often find this in the storeroom. Nurses often use this for wound care, and they come in various sizes from the very small, like you'll see this one over the hand, to much larger ones that can actually go over like the lower back, like this strip right here. This is a pretty tiny one. I like to have 2 different sizes, kind of like a small, medium, and a pretty large one. And these are pretty handy to have because when you give showers, you don't want to get certain parts of the body wet. Say they had like surgery or something and there's open wounds, there's staples, stitches, anything that you don't want to get wet, you probably want to cover this with an occlusive dressing that's impermeable to water. And most of them, I believe, are sterile, but they don't have to be. Basically, you peel the packaging open and there's a backing to it. And what's nice is you can actually cut these to size, but it's probably best to get the most approximate size that you can, the best fit for the body part. So say they had like a lower lumbar surgery or something, you can place it over their low back, like a strip down there. Now, depending on where you work and what your facility has, you might have different kinds of branding, but basically you want to get a clear plastic kind. You see here in this picture, there's like a dressing, like a white dressing. You don't actually need this. You just need the clear, transparent plastic tape, and it's a sticky tape. But what you want to avoid using is island dressing. This is like a non-clear fabric-y kind of material. I don't like to use these at all. One, because it doesn't have any plastic to it. So basically water just seeps right through. So personally, I don't think there's any point in using this kind. You probably will see some patients with this already. And basically what I like to do is I just kind of like to use the occlusive dressing, the plastic, and I just place it right over their body part that has that dressing already, like kind of in this picture. What's important to keep in mind is to basically to cover all of the edges. So you see here, it's edge to edge with some overlap, and not to basically go like under it or behind it or right up against it, but basically cover it. The job of the plastic is to prevent water from seeping under it and getting to the body part, say an open wound. And the point of this is basically infection prevention, right? Let's say because they haven't showered in a couple of days, maybe weeks, maybe months, other parts of the body may have bacteria, whatever bad things. When you're washing, it may get into this location. Let's say even you have dirty water, whatever in the shower, you don't want it getting into these locations. And I generally like to cover open wounds, staples, stitches, basically any broken skin, decubitus ulcers. Decubitus ulcers, nursing will probably have this covered already, and you can basically cover with this clear plastic. If you have any doubt about this, ask nursing how or if you should even cover it up. Where I work, it's a pretty small team, and I know all the nurses, and the nurses know what I do, and I give showers a lot. And I do this so much that sometimes I don't even ask the nurses already. But if at any time you're unsure, just ask nursing how or if or where or what to use to cover it up. But this is a general good starting point. Now, if possible, after the shower, try to remember to remove this occlusive dressing that you placed. One, because you placed it and nursing didn't have it there in the first place. But 2, because it was likely that the wound was open to air. Even with like an island dressing, it's permeable to air. But the plastic dressing, because of the nature that we prevent water from getting to the wound or the skin, it also prevents air from getting it, and that delays healing. So try to remove this. Now, if you don't have the opportunity to remove this plastic dressing, definitely let the nurse know so that they know what's going on and they can remove it. One thing that can get tricky is that sometimes the sticky plastic is so sticky that it sticks to whatever is under it. So let's say an island dressing that's fabric, and when you peel off the plastic, it might peel off any other dressings that were there prior with it and exposing the skin. Now, this may or may not be a bad thing. If the nurse is expecting to replace that dressing, let's say it's been really old, it's a couple days, or it's a daily dressing change, then you're probably doing them a favor. But sometimes they don't want it removed. Let's say they just placed that dressing there and you don't want to annoy your nurses, right? So here's my pro tip for that. So when you first get the dressing, it comes in a large rectangular square packaging, right? And you peel that open, you throw that away. Kind of like a Band-Aid has a backing, all of these dressings have a backing too. Like this circular piece here you see has a backing that matches exactly the same shape, right? So what I like to do is basically I kind of peel off or I cut the plastic so that it doesn't cover everything under it that it doesn't need to. So what I mean by that is you see how if you were to peel off the entire backing from the occlusive dressing that you get, the entire piece will stick, right? So it'll stick completely to this prior old island dressing. And let's say you don't want this removed. Well, when it comes time to remove this plastic, you'll probably have a tough time because it'll peel off this white island dressing as well. So one thing you can do, because your shower is temporary and you're planning to remove the occlusive dressing anyways, how should I say this? What you can do is you can leave part of the backing to cover up this white part. So instead of using the entire adhesive for the plastic occlusive dressing, you can use that backing and kind of tear off and leave it so that only the sticky part is the part that's on the border. And the backing is you can re-adhere it. I mean, it doesn't have to be perfect, but you can you basically want to cover that white part too. So essentially, you're sticking two pieces of material on top of this white original island dressing. This perimeter here has one layer, and this white part right here has three layers. The original one that was left either by the surgeon or changed by the nurse, the backing that came with the plastic, and then the actual plastic itself. So you'll have three layers here. So when it comes time to peel everything off, this part will come off a little bit more difficult. And when you peel off any plastic tape or dressing, especially for the older population who may have thin or fragile skin, be very careful, go very slow. Don't go fast like a Band-Aid because it is prone to bruising, skin breakdown, or even bleeding, right? Because this area probably isn't perfusing very well. Now, I'm not a wound care nurse or anything, but that's basically based on my experience. So what you can do is you can hold the skin down and make it more taut and tight, and then peel off the plastic very slowly instead of just peeling the plastic by itself with one hand. So try to use two hands for this. And because you have three layers of tape here and this part isn't technically sticking to the island dressing, it'll come right off. Number 4 on the list are garbage bags. And you'll probably find this from housekeeping or EVS in the trash cans, in the trash bins for the ones that the patients use. So what do I use these for? I use it to cover any parts of the body that I don't want to get wet. So similar to number 5, the island dressings, which is kind of like the off-the-shelf version. But the one limitation is it's limited in size and it only covers a certain part of the body, like three-dimensionally. Whereas you can use a garbage bag to cover, say, a whole extremity by wrapping it over the arm or over the leg, anything like that. And I like it because they can be very large, right? They're whole like multiple gallon size, so they can cover like a whole leg. So let's say you had a patient come out of surgery and they have an X-fix, and those tend to be really large, right? You have all sorts of horror coming out of the lower extremity. These plastic bags will be able to cover them right up. And what you kind of want to achieve is something similar to this. So let's say they have like X-fixes coming out of their lower extremity. You would basically be able to cover the whole lower extremity. This picture is actually showing a commercial product. However, any clear plastic bag can do the same thing. And why do I like clear plastic and not say a like non-transparent bag is because you can see what's going on. And that's important because if you get any water inside, you want to be able to see it. And I like to combine number 4 on my list with number 3, and that's plastic tape. Here I have a 3M transport medical tape, and notice that it's kind of like a clear plastic kind. Clear it doesn't technically have to be, but the kind I most encounter are clear. And notice I'm not using like medical tape that's like white. And this kind is great because it prevents water from seeping through. So what you can basically do is you can combine the plastic garbage bag, bring it over their extremity, and then wrap it over at the top, like here circumferentially. Remember how I like to have clear plastic? If any water goes through the tape, you'll be able to see it inside the garbage bag, or it may kind of fog up. I don't like to use medical tape like that white clothy kind because that kind is not impermeable to water and water will go right through it. And obviously, when you and your patient are done with the shower, you can remove this tape very easily and then throw away the garbage bag. Another pro tip I like to do is basically instead of taping off the end and having it kind of sticky, I kind of like to fold a little edge here so that it's not sticky to make it easier to remove the tape later on. And after the shower, it may be hard to find your edges. What I like to do is at the very edge of where I end the tape and peel them off, every single time I get a new piece of tape, I kind of fold the edge over so it's not sticky on kind of like the very edge of it. Going back to plastic bags, they're not just limited to covering upper extremities or lower extremities. If you have shears or scissors, you can actually cut the plastic bag and make it into any shape you want. An example is, let's say a patient has an IV in a difficult spot. So what you can do is you can basically cut it to size or basically a slightly larger and just cover like the IV site or circumferentially go over it and then tape it up with the plastic tape. Number 2 are commode buckets, and these are important to have on hand. Basically, I find that when patients go and have showers, sometimes they have the urge to have a BM. Maybe it's because sometimes I give showers on these rolling shower commodes and they have cutouts that make it feel like patients are sitting on a toilet seat. So they kind of have the urge to go. And by the time they need to go, you probably don't have time to go and find a commode bucket. So having it on hand, either in the shower room or just nearby on the shelf, basically within that same space that you're in, basically within arm's reach or a couple steps away so that you can make it in time and place it right under them. Instead of having to go and find it, and by that time it's too late and it'll be basically a mess to clean up and you might have to call like housekeeping and things like that. Or it may not necessarily have to be that you're using a rolling shower chair with the patient. Just the act of them transferring from surface to surface, maybe they're mobilizing, they haven't mobilized in a long time. Maybe they ambulated a long distance from the room to the shower room, so it gets their bowels moving. Whatever it may be, it's a good idea to have this on hand. And of course, as occupational therapists, we love it when patients are able to do the ADL of toileting and have their BM, so it's definitely a good idea to be prepared. Which leads me to number 1, towels. Yep, it's kind of obvious. When occupational therapists give showers, they gotta have towels, lots of them, right? Because 1, we don't want to cause a flood in the shower and flood out the whole unit. And 2, because we want to prevent slips and falls. And 3, because we also want to give patients privacy, right? So for them to cover up. So is 1 towel enough for a shower? Nope. Where I work, we have like, I think 3 or 4 sizes of towels, but I basically just go for the smallest one and the largest one. The smallest one being like a washcloth so that patients can use it to wash themselves with. And the larger, thicker ones I like to use basically for patients to dry off. So here I have a picture of a hospital shower. This one is actually much larger than the ones that I have or the ones I've seen. So this is actually really nice. Notice that it has like grab bars and a shower head. You got to have your shower head too. While this is actually a large shower and it's great for the patient, it's probably very prone to flooding. It has this tiny little drain here and water can tend to flow off to the side like this. So what I like to do is I like to create a barrier or a wall. So I basically roll up towels and I place it kind of like along the edge here so that water does not seep through. Now you don't technically need to roll them up. You can just kind of place them on the side here so that as water flows away from the shower and towards the bathroom, it gets soaked up by these towels. Now, housekeeping and EVS probably aren't fans of me when I have to give showers because I use up a lot of towels. And the downside to towels when they get wet is they get very, very, very heavy, right? Water is very dense. So keep this in mind when you clean up after the shower. Try to dry up the towels as much as you can. I like to step on the towels and kind of get as much water as I can using my body weight into the drain before I place them into the bin. And basically you have to weigh the pros and the cons, right? The cons is you're kind of using a lot more towels, but the number 1 most important thing when you give showers is safety, and you don't want a patient to slip, you don't want staff to slip, and you definitely don't want to flood out the shower and flood out the unit. And my last pro tip for towels, what do you do if you don't have enough towels? Well, in a pinch, if you have to give a shower and you can't find enough towels and you don't have time to go get towels or have staff get towels or to go and hunt down towels, what you can do to contain the water and to prevent flooding and slippage is to use other materials to soak up the water that you find in the supply room. So things like bed sheets are pretty good because one, they're already really large, even larger than towels, and two, they do a really good job of soaking up water. So that concludes the top 5 things to have in the shower with you when you're giving showers as an occupational therapist. Of course, this is not an all-inclusive list, but these are my top 5 favorites to have. What do you think? Let me know in the comments. I'm Jeff, the OT Dude. Thanks for watching, and I'll see you in the next one.